All right, this was a question. How do you relocate a biceps tendon? The biceps comes right up through the groove, but can have a retinaculum that has a retinaculum that goes right across it. So sometimes that retinaculum does not hold that bicep in that groove right there. And the bicep can pop up in between the retinaculum and the actual bone itself, either laterally or medially, just like this. How do you know which direction it's gone? How do you know how to test which direction to get it back in? Probably the best way is to take, like you're testing the biceps right here, except you're going to do external or internal rotation. If you hold the arm in place and have somebody go into external rotation or forcing that external rotation, you test it just like that. This right here is going to cause the bicep to come more medially. Okay, so if it's already subluxed medially and you're testing across the body while they're trying to hold it out, they're not going to be able to do it. It's going to fail. Now if it fails, you can push from medial to lateral, okay, and retest it. So have somebody hold it there and then you retest it to see if it strengthens up. If that's the case, that's going to need to be your correction from medial to lateral. When you're correcting from medial to lateral, you're going to put them in this position right here, get medially on the biceps tendon and distally, and you're going to have them rotate in while you're helping that tendon glide right back in the groove. Notice my hand is not moving much, but the tendon is running into my finger and the groove is going underneath it, so it's relocating it from medial to lateral, just like that. And you're going to work your way up until you get to the top. It's going to be super tender and very painful all the way through, okay? But this is how you're going to relocate it. And you work your way up and you work your way back down, and you'll start to get easier and easier and less painful as it relocates. Then you come back, and again, you test across their body while they're holding, and it should hold right in place. If it doesn't, go back and relocate a little bit more. You'll find a spot where it hasn't fully relocated, and you'll be able to test it again, and it'll be solid, just like that. Okay. What happens if it's gone laterally? You can push, or you can test out while they're trying to hold in, and again, what that does is it'll take that tendon a little further out that direction, and if it's already sublux, it'll be weak going that direction. You again can hold it in, or have them hold it in, retest it, and it should strengthen up, and that tells you you need to go from lateral to medial with this release right here. So you put them in this position, and you come right above. You're going to go kind of superior to inferior here, or lateral to medial, and again, it's hard to show this. I would get my fingers on the top like this while they're going into external rotation. So you get on the lateral side of the biceps tendon while they're externally rotating, and it helps that tendon to glide right back into that groove and relocate back into that groove right there. Okay, and you're going to go back and retest, make sure both of these are nice and solid. If it subluxes on a regular occurrence or happens quite often, best thing you can start to do is to either dry needle the retinaculum to tighten it up, almost dry needling, doing a little bit of micro PRP in there, or go in there and have somebody do some prolotherapy to tighten it up and tighten that retinaculum up so that tendon isn't so sloppy and hops either medial or laterally very easily right there. So I hope that helps out. It's going to help a lot of people who've got pain right up through here where they feel like their rotator cuff may be involved, but their pain is right down their biceps tendon. It's super tender up and down that tendon, but that'll be a quick and easy correction for biceps tendon subluxations, where they either go lateral or medial. Okay, hope that helps you out. Hope that helps your patients out.